Hello class, my name is Taylor Helsher and today I will be describing pregnancy, labor, and parturition. So here I've drawn a few pictures to help me explain. I have a placenta, I have a sperm and an egg, I have a zygote, an embryo, and a fetus. I have a child after birth, a ultrasound transducer, a pregnant lady, and also a scale of how dilated the cervix is going to get throughout the stages of labor. So, as we all know, pregnancy is going to begin with conception, and this is where the male sperm is going to fertilize the woman's eggs, and this is done through sexual intercourse. So the fertilized egg is going to be implanted into the uterus, and then it is going to form into a zygote, followed by an embryo, and then lastly into a fetus. So pregnancy is going to last 9 months for humans. For cats and dogs and other animals, this is going to be different. But this can change or vary depending on complications or other factors that may occur during the 3 trimesters. During this time, the baby is going to undergo a bunch of changes, as well as the pregnant woman. She may start to see signs of morning sickness, fatigue, mood swings, and even weight gain. During this time, the woman's body will undergo many changes, and it is very important that the woman gets the prenatal care that she needs. This is going to include regular checkups and getting ultrasounds of the baby, monitoring the baby, which is why I've drawn the transducer here. So moving on to labor. Labor is the process of childbirth. This is typically going to be divided into 3 stages. The first stage is going to be the longest, and it involves contractions, which will help dilate the cervix. The cervix is usually closed, but is going to open to allow the baby to pass through. And during this time, the mother may experience mild contractions that are going to intensify over time. The cervix will then begin to dilate 3 to 4 centimeters, and this is not super accurate, but and then this can last for multiple hours. The contractions are then going to become more intense, and they're going to happen more often, and the cervix is then going to dilate 6 to 7 centimeters or more. And then the second stage of birth is when the cervix is fully dilated, so that's going to be our 10 centimeter mark that I've drawn here. And then the baby is going to then move through the birth canal and be born. This is when the woman is going to be pushing, and then the healthcare provider is going to help guide the baby out of the vagina. She's going to help position the baby to help move it out, so that way both the mother and the child are safe. And then the third stage is after the baby's born, which is where the mother's going to push out the placenta. And this can occur anywhere from like 5 to 30 minutes after childbirth. During this time, the mother may start to get contractions again, and some signs of labor are going to include bloody shows, which is just like a bloody tinted mucus out of the vagina, and also contractions and backache and water breaking, and there's a bunch of other ones that might possibly happen, but those are going to be the most common ones. So then moving on to parturition, and this is going to be referring to the act of giving birth, and it's actually the process of labor and the delivery of the baby from the mother's body. This can occur vaginally or through a C-section. It just kind of depends on complications and health of the mother and the baby. And then after birth, the baby's going to get its vitals checked and its weight will be taken. And then during this time, the mother may experience more contractions as she is going to push out the placenta. The baby is then going to be given to the mother, and this is going to be when they start to bond, and this is if everything goes smoothly and there's no further complications. And then during this time, both the mother and the baby will be monitored super closely just to make sure that there's no postpartum issues or any other complications that might occur. So overall, pregnancy, labor, and parturition are complex and involve physical, hormonal, and emotional changes for both the mother and the baby. And yeah, thank you guys for watching.